with him and say it loud. The public wants a public option. Now, we need to say it loud to our fellow Democrats like Blanche Lincoln, so that the folks in Arkansas can hear us. We need to say it to Ken Conrad so that his folks in North Dakota hear us. And Ben Nelson can hear us in Nebraska. That other party, they got to hear it even louder. Republicans like Charles Grassley and the ever-sunburned John Boehner and Joe Wilson, and also bigots, big mouths like Rush Limbaugh, Sean Hannity, and Glenn Beck can hear us too, no matter what planet they may be on. Healthcare is a right and not a privilege. That's what it should be. We all deserve the same quality health care that their families in the United States Senate and House enjoy. Now, Bob Dylan was a great singer, still is, but certainly was when I was growing up. He sang his song, "Don't Criticize What You Can't Understand." And if these folks can't be part of the solution, then, as the song says, get out of the way. Brooklyn's got 5 times more people than Senator Mike Enzie's entire state of Wyoming. If we can get pretty loud here in Brooklyn, call us what you will, shy and retiring, you'll never call us, that's for sure. So we can get pretty loud and be in your face if we have to. So let's hear it. The public wants a public option. Now, we'll not rest until we can truly say to Brooklyn and all of America, health is on the way. I know it's going to happen. This is the time. I never want to see a person in this nation experience what I did when I was a boy, waiting for hours to be seen by a medical professional and then turning us away because they didn't have time to see us. I never want to see a time when we see our emergency rooms as they are in Brooklyn today, where people can't get health care. Now listen, you're a billionaire, millionaire, and you make a good living. If you want to spend and buy and rent a whole suite of rooms if you're sick, if you want to have gourmet food in your room, God bless you. That's your business. If you want to spend your money that way, that's your business. But every American, rich or poor, and I have been both, not rich, but I've been poor up. All I can tell you is everyone, when it comes to health care, deserves the finest health care this nation can provide. That is the true promise of America, and America will deliver. Ladies and gentlemen, let me introduce our Deputy Borough President, Yvonne Graham. Yvonne?
Thank you so much, Marty. Good afternoon, everyone. I have spent most of my professional life in healthcare, a nurse by training and a public health professional. I am the founder of Caribbean Women's Health Association, an organization that was founded to help reduce health disparities, be a voice for the voiceless, and help people to access health care. I have seen women deliver babies in their homes because they did not have access to health care. I have seen people die unnecessarily because they did not have access to health care. The time has come for us to have a public option now. It is unconscionable that the richest and most powerful country on earth cannot provide basic health care for all of its residents. I believe that health care is a right and not a privilege. And we should not stop. We should not stop until we have a health care system that works for all Americans. Thank you.
Thank you so much that we have our champions here in Brooklyn calling for what we've been calling for, which is a robust public option. It's not a single payer plan. We could move for what we can get, right? I'd like to introduce our first speaker, Dr. Manel Silva, who's with the National Physicians Alliance of New York, and she's going to have a few words. Good afternoon, everybody. Thank you so much for coming out. I'm Dr. Silva. I'm from the National Physicians Alliance. With my day job that I actually get paid for is working at the Mount Sinai Adolescent Health Center. Now, I'm a Brooklyn resident. I work at Mount Sinai, but what's important about that is at least 25% of our patients come from the and young adults. The reason why we have so many patients coming from the Brooklyn area is because of our broken healthcare system. The most likely people to be uninsured are 19 to 29-year-olds. 30% of 19 to 29-year-olds are uninsured. Where are they going to go for medical care? They need medical care as well. Just to give you an example of how amazingly broken the system is, one of my patients who she was in foster care, had aged out, she was basically, living life on her own without really any adult help, had a full-time job, she had finished college, and she lost her job, another victim of the economic crisis. She was making $6 too much on unemployment to qualify for Medicaid. $6. Let me put that in other numbers. She was making $754 a month on unemployment. That was $6 too much for Medicaid. But the biggest problem is that this patient is diabetic. She requires insulin therapy. So she could have ended up in a diabetic coma in the hospital, costing thousands of dollars had she not been able to get access to a free clinic where we are able to get medication and medical care for her through state funding, through some random funding, but this is not the way that the system needs to be. And I get frustrated by this. Physicians constantly are frustrated by the system. I did not go into medicine. I did not spend all this time studying so that I can be dealing with a broken healthcare system, so that I cannot provide the care that my patients deserve and need. That's all I want. I work too hard to be in the system. And this is one of the reasons why, as many of you know, 63% of physicians support the public option. Let me tell you why that's really important. Physicians don't get paid potentially as much as they would than in the private healthcare system. So why is it that the majority of us, the overwhelming majority of us, support the public option? We've had experience with Medicare, we've had experience with Medicaid. They don't pay us as much as the other systems do, the private system does. But we prefer a public option because we know that our patients get the care that they deserve. They will not be denied for ridiculous things. They will not have to wait before they're able to come to us because they don't have health insurance and then they're incredibly sick and we're treating end stages of a disease rather than preventing it at the beginning. Physicians prefer to be working in a system that's functional, where the bottom line is patients, not profits. That's what we want. We're willing to have that kind of a system because that's what we believe in. So as physicians, 63%.
This is Bernie Smith for Issues in Focus, and I am at the session at the Brooklyn Borough Hall, sponsored by MoveOn.org, and they're here supporting a public auction and calling on all citizens. And of course, people are answering the call, healthcare reform now. Again, this is Bernie Smith and the Brooklyn Borough Hall, talking about public option and what it means for not only the poor, but for all Americans, that healthcare should be a right and not a privilege.
And now is really the time where we need to show Senator Schumer that he needs